So England is going back into a national lockdown, as is Scotland. The UK Prime Minister Boris Johnson ordered the restrictions until at least mid-February. He says a new variant of coronavirus is spreading quickly and hospitals may be overwhelmed.
It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home.
The UK is using an alert level to determine how tight the restrictions should be. It started off with 3, then they added 4, and now they've just created level 5. It's it's the highest, and it calls for extremely strict social distancing. It means there's a material risk of healthcare services being overwhelmed. The alert level reflects the number of cases and how fast the virus is spreading. Fiona Godley is with me, the editor-in-chief of the British Medical Journal, the BMJ. Fiona, this is the fact that this has happened. Look, we knew Christmas was going to be bad, and then we knew that there was this new variant. But listening to the Prime Minister tonight, I'm getting the feeling things are worse than anybody expected.
I think you're right, Richard. Things are very tough at the moment in the UK, as I know they are also in the United States. And I think the government were hoping that the virus would be kept under control sufficiently so that a vaccine program could keep us safe from it. But I think what they've had to recognise is that cases are going up so quickly, hospitalisations and deaths also, and they've got to take this other action.
Is it realistic for us to... I mean, Germany is in lockdown. France has got a curfew. All the other countries have. Is it, firstly, 2 parts of the question, realistic that the UK variant will transmit to more countries faster? I mean, it's prevalent in the UK, but it will be prevalent elsewhere. And the second part, will other countries invariably extend their lockdowns, do you think?
Well, I think the presence of the new variant is obviously a contributing factor in the UK, but I think messages I'm hearing is that it's more widely spread around the world than may be realised. And the reason it's been so closely identified in the UK is because we have the sufficient testing to identify it. So that's a good thing. The extent to which it is actually driving this surge in the pandemic in the UK and elsewhere is very hard to judge, or at least I don't know the answer to that. But I think the pandemic was already surging up back in September when this new variant was really only very early days for it.
You see, that's the interesting part, Fiona. The inability, to some extent, both in the US, UK, many countries, for social distancing, absent a full lockdown, normal social distancing, to get a grip on the virus. We were failing at that already. I wonder, therefore, is it likely that these national lockdowns will have to last pretty much until the decent weather arrives?
Well, I mean, just to say, I think it's important to say this is a dire situation we're in, and it's possible to say, did we need to be in this dire situation? If the government had taken earlier action, more prolonged action, and had used that precious lockdown in the spring and summer to build a proper test, trace and isolate system, they failed in the UK to do that. As you're asking about kind of current measures, so yes, we need to continue social isolation, we need to have mask wearing, hand washing, reduce social interaction, people need to take the vaccine if it's offered them. And I think with those interventions, we may hope to be able to come out of these tighter restrictions in March.
Has the BMJ taken a position on the government's policy of varying the dosage durations, 5 weeks up to 12 weeks, possibly mixing and matching the viruses as necessary? The doctors' organisations have come out as strongly basically warning this has not been tested or confirmed. What's the BMJ's view?
I think they're right. It hasn't been tested or confirmed. The communication has been rather chaotic. But I do think from the science base that it makes sense. A greater gap traditionally with vaccines does mean a greater immunological response. So in many vaccines, the gap is much larger than was used in these trials. So I think that there's science to justify it, but not science on this vaccine.
If you had to sum up the situation tonight, I mean, the United States look, I'll be blunt. I live in New York, and you could ask people on the streets, and they've got no idea what the real regulations are in terms of mixing with houses. There's certainly no tiering or alerting in that sense. California has more. Are we looking for things to get much worse?
What do you mean in terms of the restrictions or in terms of the cases?
I think I'm talking about the situation. Are we looking at, we knew January was going to be bad, but is it your gut feeling, Fiona, having studied and looked at this now in greater detail than most, that we've just lost this?
Well, I do think, looking back, the decision-making has been poor, and I think we are in a very dire situation. People are very tired, the public are tired, the healthcare workers are tired, the school children, no longer able to go to school, exams, worries, all those things are adding to the strain. You then got the other side of this, which is, of course, the economic decline, people losing their jobs, their livelihoods. You've got increased suicide rates. We've got, very, very many factors which do, additively give one a sense of enormous fatigue around this, and also continuing worry. The science behind the vaccine has been fantastic. All the vaccines, the amount of work that's gone into those, the brilliance that we've created, all of these vaccines that seem to be extraordinarily effective and safe in such a short time, and adaptable to new variants. We're hearing that they should be able to adapt if needed to new variants on the science side. The rollout of the vaccination, on the other hand, seems to be really rather inadequate, poorly designed, poorly planned, and that's very distressing to see that. We really need governments around the world to absolutely put their backs behind a proper vaccine rollout.
Fiona Godley. Fiona, thank you. Now, staying with the vaccines, I appreciate, Fiona. Staying with vaccines, a second vaccine means another weapon in a fight it's currently losing. It also allows a more aggressive approach to controlling the virus. Salma Abdelaziz reports from London.
A moment of national pride. A vaccine created by Britain's very own Oxford University goes into the arms of those who need it most. The rollout of the inoculation, developed alongside AstraZeneca, started with 82-year-old Brian Pinkert, who can soon safely celebrate his 48th wedding anniversary. The third recipient was Professor Andrew Pollard, one of the chief scientists behind the revolutionary vaccine.
I think this is a really critical moment. We are at the point of being overwhelmed by this disease.
The UK's health secretary calling this a pivotal moment in the nation's bitter battle to defeat COVID-19.
I'm incredibly proud of the British science that's got us to this place. We've been working for a year to get this vaccine ready.
The vaccinations happening behind me here are not the only first. The UK will also be the first country to try a delayed dosing strategy. Patients will get the first injection and wait up to 3 months for the second one. Health officials here say that initial dose should protect against significant illness and keep people from ending up in hospital. But it's a controversial plan that's divided the medical community.
The policy will allow up to twice as many people to get vaccinated. Prime Minister Boris Johnson says tens of millions could be shielded from the worst of the illness by spring.
We've got a new variant that is requiring extra special vigilance, and we will do everything we can to keep the virus under control.
That variant has caused an unprecedented wave of COVID-19 cases, worse than at any point during this pandemic. And hospital chiefs are ringing the alarm. They say the healthcare system may soon reach a breaking point. It is an ambitious and some say risky approach to vaccinations, but a bold battle plan may be the only way to win. Salma Abdelaziz, CNN, London.